Hi, I'm Dr. Jha from Clinic in Leamington Spa. Today I'm going to talk to you about a common condition called fungal toenail infection. In more medical term, they are called onychomycosis. Onychomycosis is a fungal infection of the toenails. Um, if you have fungal nail infection, you should see the help of GP, your own doctors, and by examination, they can tell you there is a suspicion of fungal infections based on few features, and those features are discoloration of the toenail, thickening of the toenail, white or yellow discoloration of the toenails, onycholysis. Means the nail is actually partially separated from the nail bed, and that is called onycholysis. Then there are brittling. The nails are very flaky, they break off very easily. So these are the common features of fungal toenail infection. Now, if you are suspecting fungal toenail infection and diagnosis is doubtful, then your GP or doctor will generally send pieces of your nail clippings to the laboratory to see if it grows any fungus in the laboratory to confirm the diagnosis. Once the diagnosis is confirmed, then there are various modalities it can be treated, such as oral tablets. But again, you have to take these oral tablets for quite a prolonged period of time, say 6 months, 8 months, 10 months, and so on, because the blood flow to the toe is generally poor and the drug doesn't reach very easily, whereas the fingers, the blood flow is very good, therefore they tend to grow a lot faster than if you sort of compare the toenails. The toenails, they grow very slow, they have stunted growth, and you cut your own toenails, say every 2 months or 3 months. If you got a fungal nail infection, the growth is further stunted. So these things you must must consider. Now the other thing, for the treatment, they apply a topical liquor, which is antifungal topical treatment. It can work if the disease is very early stage, but if it's a chronic disease, the disease has been there for many years, the topical treatment may not work because the drug penetration there is poor, and sometimes we may have to combine oral as well as topical treatment. Now, there has been some research publications done. If you read internet, introduction of laser treatment in the treatment of fungal toenail infections. Now, laser treatment, although it sounds quite attractive, but to be honest with you, it's not that everything which glitters is gold. Of course, this also has some failure rate. At Renew Skin Health Clinic, we also offer laser treatment, and where we treat all the 10 toenails, even though you may have an infection in the 1 or 2, and the rest remaining toenails may appear normal, but we will be treating all those 10 toenails, because subclinical infection may exist even the normal looking nails, and that is the reason why we treat all the 10 toenails. There is an intensive phase of treatment where you will be coming every week here, and we laser all them 10 toenails, and for a period of 6 to 10 weeks the intensive phase lasts. After this period, there is a maintenance treatment for which you will need to come to us every month for up to 8 to 10 months. If you're asking, is there any guarantee for the treatment? I'm sorry, there is no guarantee, because there is a failure rate, as I said earlier on in the discussion. So having considered all these things, seek the help of your GP, see what that says. Generally speaking, oral treatment is not suitable for anybody who is elderly patients. Topical treatment you can try if you are an elderly patient. If you are a younger person, you can try oral as well as topical. as well as laser. So when we do the treatment with the combination of three modalities together, then the success rate is better. And that's what the most research publication tells us. I hope this suffice your knowledge in fungal toe infection treatment. Thank you very much.